Hey everybody, thanks for joining us. My name is Alexis Hunter and I'm the community liaison for Wilmington Health. Today I am joined by Dr. Chris McKibbin, who's an internal medicine physician here at Wilmington Health in our Hampstead office. Thanks so much for joining me.
No problem. Thanks for doing this.
Yeah, absolutely. So tell us a little bit about internal medicine, what that means, what types of patients you see.
Sure. And I think it's good to do that because a lot of people don't really understand the differences between medical specialties, especially when it's kind of all encompassed in primary care. But that is what I do. I'm a primary care physician. I am internal medicine, not family medicine. So that means that my residency was focused on adult disease as opposed to all encompassing children and adults and obstetrics. But my training in particular at the University of Kentucky was in the primary care track for internal medicine. So I did spend some time learning about hospital medicine and how to manage patients in the hospital, of course, adults in the hospital, but mainly was focused on outpatient medicine and primary care.
Okay, great. So many people think you go to a doctor when you're sick. Why is it important for folks to establish care with a primary care provider like yourself?
Well, I think it's important to have a primary care doctor that you like and that you can, go to, who knows you, who knows your history, as opposed to going to like a walk-in clinic every time you're sick. You don't know who you're going to see. If it's a recurring condition, then it could easily be something that's missed in that one time that they evaluate you in the ER or in the walk-in clinic. So for that alone, I think you should have somebody that you can visit that knows you well enough, knows your background, not just your medical history, but kind of knows you a little bit personally. So they know how to read, what's been going on with you lately. And of course, then, with our medical record systems, they can look up everything that's been going on with you in the past however many years and really follow any of those problems that are recurrent.
Yeah, absolutely.
Or anything acute too. If something comes up and you're not even really sure if it's a problem or not, you want to have somebody that that knows you, that you can go to and sort of check you out, even answer just a couple simple questions and see if it's something that is worth looking into further.
Yeah, absolutely. That's great. So the world of COVID during this pandemic brought us quickly into virtual visits, and many providers had never even offered a virtual visit before March of this year. So tell us about what types of visits can be done virtually and how do you actually doctor during a virtual visit?
Yeah, so we started virtual visits right when COVID happened. I know that some people in the administrative parts of Wilmington Health were already getting this kind of set up because telehealth has been around for a little while and virtual visits have, but we had not been doing it. And I certainly had no idea what to expect. But when COVID happened, it was kind of leaning toward that way. They just flipped the switch and we started doing virtual visits. And I was actually excited to be a part of that, but I was definitely skeptical that it would be able to be applied to most medical conditions or issues that come up. How can you really address something when it's just over a webcam? But the answer is you can do a lot over a virtual visit. Because to be honest, most of what I do is talking and getting history and details. And physical exam is absolutely important, but you can even do a lot of that through the webcam. I just finished with a patient where we had, someone else everybody's got a webcam or a camera or something, take his phone and show me his leg. And I could see exactly what was going on and make that diagnosis right there. But that's, a lot of the work that goes into my job is done by talking, gathering details, reviewing labs and imaging and notes from other a lot of it happens even outside the exam room, just to, following up on everything. And being able to touch base with a patient, even when we can see each other's face, but that's just talking to them, even if it's a phone call, sometimes that's what we do. It's a lot can be done, definitely. Wow. So the virtual visits have been very helpful.
That's great. And I'm so glad that we were able to do that so quickly. But what can a patient do to prepare for a virtual visit if they're having one for the first time?
Well, with our system, they'll get a text or an email shortly before the visit to kind of make sure that they can get connected with the technology that we're using. Like I said, phone calls are adequate as well. Most of the time, insurance companies now with this pandemic are treating that like a visit as well. But so that's one thing, is trying to make sure they have the technology. Most of us do. If you have a smartphone, you have everything that you need right there. You want to be in a place that has good internet access if you're doing that. If you're driving, pull over. We've had that a couple times. But one thing that they can do as far as preparing for the visit part of it is some very simple vital signs that they could gather on their own. You know, a recent body weight is actually pretty telling, especially if it's somebody that we know that we've got their weight before that. So weight is important. Temperature, I mean, absolutely temperature is important to see if they have a fever. If you got a blood pressure cuff, that tells you your blood pressure and your pulse rate right there. Pulse rate is one that's also important if you can get that. Don't know how many people are able to find their pulse and measure it, but that's very telling, especially if you're worried about an acute infection. How fast is somebody's pulse rate?
Yeah. How can somebody maybe check their pulse rate?
Well, most of the time we do a radial pulse, that's with the wrist. And I find it's easier to use 3 fingers when you do it. Use the tips of your fingers. They're the most sensitive part. So you lay them down. If you follow your, I don't know if you can see this, but you follow your thumb down right here. This is where I like to find the pulse. It's a radial artery. And you put 3 fingers in a, oh man, this is going to be difficult. Put 3 fingers in a line right here. Gently, don't press too hard. And you should eventually feel with one of those, it's 3 just to triple the sensitivity here. You feel the pulse. And if you can count, I normally just tell, so sometimes we do this over the webcam, but if you count how many beats there are in a 15-second period, you multiply that by 4 and you got your beats per minute.
Oh yeah, okay. Very cool. That's a good thing to know. It
is. I mean, it helps with infection. We want to know how fast someone's pulse is, but also if somebody's got arrhythmia like atrial fibrillation or some kind of something called bradycardia, where it could be abnormally slow. We evaluate all kinds of different things over the virtual visit. So every single little bit of information you can give us is helpful.
That's great. So this is all great information. I appreciate so much you chatting with me. And for everyone that's watching this, if you want to establish care with any of the providers at Wilmington Health, please find the details for how to do that in the description of this video. We look forward to seeing you soon. Thanks.
Thank you.